It's a podcast with our host, Tom Quigley of ClaimLinks. Tom, oh my goodness, here we go again with another really interesting topic. Today's topic is group health insurance versus individual plans. Which saves employers more? What are the biggest differences between group health insurance and individual plans that employers need to understand?
There's really none. The ACA makes all the plans the same. So the biggest difference is in some states, the networks aren't as broad as if you buy group health insurance in those states. In some other states, there's zero difference and individual is less expensive.
And most people go to the group health plan because that's what they're being sold.
Yeah, because the group agents only get paid on group health.
Oh, that's a big answer, part of the situation.
Tough question, tough answer, isn't it?
Yeah. Why might group health insurance be the traditional choice for businesses? You've already talked about that. And where does it fall short on cost savings? Because they're not giving you any cost savings.
The individual plans, like I had one in Maine, they had a company called Harvard Pilgrim, and I put on individual versus the group. Same exact plan, designed, same network. They saved $120,000 for about 50 people.
And it's that, and no one knows about this except a few people, because what you do, Tom, is you look at basically saving your client money. At the end of the day, you look at performance versus they look at, hey, they're just selling you something.
Yeah, they're just selling a product, the middleman. That's it. I'm going in saying, you've already bought into the fact that you have to buy insurance. Let me show you how to buy it the most cost-effective way and give your employees the most benefits out of it. That's it. And I work on what I see.
What are the advantages of individual plans for employees, and how do they impact on employers' bottom line?
Individual plans are great. If they leave the company, they take the plan with them. Group health insurance is like renting a whole house. Individual plans are like owning the house.
Interesting. So that's where you have X amount and you can go to your calculator. I was showing one of your new people you're going to be sponsoring, NHL Wraparound Podcast, starting this month. You'll be on. ClaimLinks is one of the proud sponsors of NHL Wraparound Podcast. When I was showing them specifically the calculator, they were blown away at the savings. When you go into that calculator and look at, which we did in one of the other podcasts, it's unreal because you're really looking at how it all fits together versus a group plan where there's really not much to shave costs at all.
I score goals. The group health agents take shots.
So how does ClaimLinks' blended approach, like the Diamond, Sapphire, and Crystal solutions, help companies get the best of both worlds?
You allow your employees to go out and get a bronze plan on the individual plans, and then you give them an allowance tax-free to buy it, and you then cover their deductibles underneath, tax-free. Those levels determine on how much you want co-pays to be, those kind of items. But the bottom line is the health insurance carriers have the products needed for you to pay half of what you're paying and provide the employee 100% more.
And you think of the strategies that you show, but then the deductibles are covered. The employees have an unreal plan. Imagine paying less a month for health insurance to the company as part of contributing, and not having the deductibles that literally can destroy you and destroy the cost by having them pay that. Because the savings that's saved, your strategy is unreal. And how
it's just a math problem to me, and it's an emotional problem to the office managers and the HR directors, and that's why they're paying what they pay.
And it cracks me up. It's all about numbers. People see a big number and they spend 16,000 hours with that person. That big number has gone down to you're getting minimum wage. Versus if you spend only a certain amount of time, get paid, and make more, you make more money. So people don't look at numbers at the end of the day. Or, oh my gosh, on paper, I look like I'm broke, but I'm really doing way better than lots of people.
It's basic math, second, third grade, and kids who would cry in basic math are the same ones making the decisions on health insurance.
Exactly. Can you share a real client case studies that highlight the actual savings companies achieved by switching strategies?
Every day. That's easy. We have a bunch of that. They're saving, any 5-person group saves 60,000. 100-person group saves over $1 million sometimes. Depends on how fleeced they really are being. Or if they have families or if they have single coverages. the families save ridiculous amounts. I'd literally save families $30,000 per family a month. Not 30, I'm talking 30,000 a year. They're paying 3,000 a month and they go down to 500.
Right. For an employer listening today, what steps should they take first to determine whether a group, individual, or hybrid solution will save them the most money?
First step is they should take the emotions out, look at the numbers, and then make a determination of how this could fit in to their company and how they could educate the employees why they're doing this, which will improve their benefits and lower their costs and also lower the employer's costs.
All right. And the best place to go is claimlinks.com. Schedule a call with Tom or his team. I appreciate it, Tom. Great topic. Enjoyed the conversation, and we will talk soon. That was a special simulcast of the Neil Haley Show and the Cutting Edge Benefits Podcast.